Yeah, we did. Want my, yeah, we want my, no, just gonna listen. Hey, welcome everyone to our integrative health speaker series. Hopefully soon will be grand rounds so we can give CEUs and CMEs for this. We're working on that. This is an every third Thursday event. For over this last year and continuing on, we're going to mainly focus on University of Miami researchers, clinicians, so that we all learn what's happening here at the University of Miami in terms of integrative health. So I'm really happy to welcome Mary Kauffman, who spoke at our conference. Let's see now, in 2022, and was met with rave reviews. Mary is a board certified music therapist working at Sylvester Cancer Center. She received her doctorate and master's degree in music and music therapy at the University of Miami. Completed her integrative health and wellness fellowship and coaching certification at the Andrew Weil Center for Integrative Health at the University of Arizona. And she's been using music and music-based interventions to help cancer survivors at the Cancer Center here at UM since 2017. Her research has included the effects of piano training on cognition in Parkinson's patients and the effects of weekly choral singing on resilience in cancer survivors. Both nationally and internationally, she has given talks such as this and has published in journals including the Oncology Nursing Forum and Music Therapy Perspectives. And her work at Sylvester involves using music interventions such as listening, singing, playing, and writing music to improve cognitive function, alleviate feelings of anxiety, encourage self-expression, promote positive mood, regulate heart and respiratory rates. Today she's going to discuss mindfulness-based music therapy, using music and mindfulness to restore and grow. Thank you.
Thank you and welcome. We have a lot of chats here about the sound. So first of all, okay, it seems to be okay, right? I'm going to send this. I'm going to put this on myself. And if you cannot hear me, please write it in the chat. No echo. Great. All right. That's good news. Well, welcome everyone, virtually and physically. It's great to see you, or to imagine that you're there. So the agenda today, brief description. It's a quick presentation. So brief description, what is music therapy? Brief description, what is mindfulness? Talking about mindfulness-based music therapy. What does that mean? What's it for? How does it work? What's the research say? And some specific interventions which are interactive, including those of you who are not visible here. You're going to ask yourself, how do we do that? Don't worry. We can hear you. Thank you so much. Okay, so what is music therapy? The American Music Therapy Association defines music therapy as the use of clinical and research evidence-based individualized music interventions to achieve non-musical goals in a therapeutic relationship. So this is really patient-centered care here. The client is very active in their own healing and their own recovery, patient needs, patient concerns, preferences, their strengths, what they can do, what they want to do. This is all incorporated then within a framework of specific interventions that are proven through research and clinical practice to achieve results. Goals could be pretty much anything from soup to nuts. We'll talk about that in a second. And the therapeutic relationship is different. This is kind of what differentiates music therapy from the use of music in a therapeutic context, which would be something like environmental music or ambient music, background music. Oops. Yeah, there we go. Okay, so in terms of goals, it can be a lot of things. It can be cognitive goals, the attention, memory, learning. It can also be psychosocial goals, like dealing with emotional processing, dealing with adjustment, communication, motor goals, speech and language. How can music accomplish all of these things? Well, as you can see from the visual aid here, music, playing music or listening, even listening to music, engages a multitude of brain areas that are responsible for attention, involved in motivation, involved in memory, involved in emotion, also motor, doesn't say that here. Music can trigger memories that may facilitate mood change or help with emotional processing. Music can engage attention pathways, very important for today. We'll talk about that later. Music can entrain primary and secondary neuromotor pathways. And areas involved in singing, very interesting, are much more diverse than areas involved in speech, which means that you can actually retrain singing areas of the brain for people who have deficits in speech areas due to traumatic brain injury, or actually, even in the people I work with, people who may have some areas of brain that are damaged from brain tumors. Different types of music therapy. There's a lot of different types. Nordhoff Robbins, maybe one of the first, deals a lot with improvisation, body method of guided imagery, very important for psychosocial progress. Neurologic music therapy that capitalizes on the parallel pathways between listening to music or playing music or writing music and areas related to speech, for example, or learning, memory, or motor skills. And sound therapy, which is relatively old, but also relatively new. It's an old concept, thousands of years old. The research is still developing in that area about how different sounds affect different bodily functions. Intervention. So what does that mean? An intervention, you know, if it's something you do. We like to say intervention instead of activity, because activity always kind of sounds like you're on a cruise. Not that we don't want you to go on a cruise, but intervention sounds a little more structured, perhaps. So something like playing music or singing or composing, that would be considered active. Receptive is more listening to music in a therapeutic way. So music therapy and cancer survivorship, that's what I do, that's where I work. I work at Sylvester. I work with cancer patients. This is in order of prevalence. So by far, in my work, support services, all of the 75%, we're dealing with psychosocial issues. We're dealing with anxiety, adjustment disorder, depression, self-image, self-esteem, isolation. Next to that are acute issues, such as pain, somatic issues, such as pain, discomfort, nausea. Next down the line would be the cognitive issues. More than anything, it's attention and executive function, information processing. This is a result very often of treatment, chemo brain, but sometimes it's a function of the disease itself, especially with different types of brain tumors. Motor rehab, speech language rehab, we'll have that a little bit, not so much. So more than anything else, what I'm dealing with and what this talk is really centered on today is the psychosocial. Now that you know all about music therapy, and you can pass the test at the end of the presentation, let's talk about mindfulness. What do you already know about mindfulness? Nothing. Great. I don't believe it. But we'll go on. So you can read the slide. Don Kabat-Zinn, the man himself, 1990, full catastrophe, can't say it, catastrophe living. State of awareness that emerges through practice of purposeful and non-judgmental attention to the present moment. Why is that good? What does that mean? Well, what does it mean first? So without falling victim to emotional and cognitive reactions, if something happens, and there's a reaction, like somebody cuts me off and I'm driving here, which I didn't today, I rode my bike. Okay, that's good. I rode my bike, school started, car cut in front of me. What do I do? Well, I can carry that with me for the rest of the day. Or I can take it for a fact. All right, I survived. I wasn't hit. This guy cut in front of me, he's probably busy, and I can go on my merry way, right? So there's two different ways of dealing with that. So instead of attaching an emotional reaction to the fact that somebody cut me off, I can just accept it for what it is and move on. That's not always so easy, but it does allow the focus to remain on the present reality instead of ruminating on the past or thinking about future scenarios, which may or may not ever occurs. So limiting attention to objective consciousness of stimuli. You're eating a sandwich. Like it. Good. Okay, something like that. It's not denial. Things happen, right? But it's the objective observation of the internal and external events. You're probably already thinking to yourself, okay, I can see how this would be helpful for people with some psychosocial, right? To develop this type of, to practice this type of training. This also, so a little later, some research, Brown and Ryan in particular, and then others started doing research on what they call dispositional or trait mindfulness. So essentially, they distilled 7 attitudes of mindfulness down into 4: observing, describing, non-judging, non-reacting, sometimes called acting with awareness. So instead of a knee-jerk reaction, taking a breath, say, okay, what's going on here? Do I flip this guy the bird, or do I just go on my merry way? Right? Okay, so, and it's talking about what makes a person mindful. The research on that has shown that greater dispositional mindfulness also translates into greater psychological and physical well-being for a number of different reasons. One of them is the study is cited there by Day and her colleagues in 2015, noted that there was an inverse relationship between dispositional mindfulness, that is the trait of being mindful, and pain catastrophizing. I'm not sure I'm saying that word wrong. Catastrophizing? Yeah, that's it, catastrophizing. Thank you so much. And if you don't know what that is, you all know what that is? Good. Okay, you all know what that is? I'm assuming you know what it is too. It's like turning a pain and having all sorts of associations with it. I'll never get better. This is the worst thing that's ever happened to me. What does this mean? And who dies soon? This is the pain. So there's an inverse relationship with it. Also, that people who have more dispositional mindfulness also have greater resilience, and it can serve as a buffer against negative thoughts and the tendency, the attentional threat bias, the negative thoughts. Okay. Dispositional mindfulness, like resilience, is fluid. You can learn it. Some people might be born with more of it, or might acquire more of it when they're little, but you can learn it. It's not like, okay, you're done at age 20, you're never going to be mindful. That's not true. You can learn it. Mindfulness practice helps a lot and can alleviate these symptoms of anxiety and depression, not only in cancer patients. There's a lot of research by, in particular, Linda E. Carlson. She has something called Mindfulness-Based Cancer Recovery. She has a whole program on that. And others in the general population that show across the board that practicing mindfulness can help you, not just cancer patients, anyway. However, some of you may have experienced what you see as a cartoon. It's not always that easy. Even if you have lots of time. First of all, you gotta find the time to do it. Or make the time. Second of all, to not so much disengage your mind, but keep getting your mind, picking it up as if it were a cat or a toddler and saying, no, you can worry about that later. It's not that easy to do it. And especially if you're going through an acutely stressful situation, and this could be anything. This could be a cancer diagnosis. This could be your spouse just told you that you're leaving. This could be you just lost your job. I mean, your car just broke down, whatever. I mean, this could be a number of things. And when you have an acutely stressful situation, it's not always easy to practice it. So, this is where the music comes. Music, in and of itself, is a mindful behavior. I don't know how many professional musicians we have here, but I can tell you, as a professional musician, that you don't get to where you are without a lot of patience. Now, first of all, non-judging. If I said something nasty to myself every time I played a wrong note, I would have stopped playing the piano when I was 4. Right? So non-judgment is big. Beginner's mind. approaching things, always thinking of them as being new. You might have played a song 578 times, but each time it's a new experience. Trust. How many of you are brass players, singers? I think I'm going to get some singers right here. You can practice all you want, but you know that at the moment of truth, what you're imagining may or may not come out of your mouth the way you expect it to. That's just the way it goes. So there's a lot of these types of behaviors that are inherent in the practice of making music. Does this mean that if you're not a musician, you are doomed to a life of mindlessness? No. You can use music to train mindful behavior, even if you're tone deaf, even if you don't play an instrument, you can do this. So mindfulness-based music therapy is the development of music interventions, and there are lots of them, that are designed to aid mindfulness practice and promote mindful behaviors. I've chosen 3. One of them is the one that I think is the most important. The other 2 are interventions that really anybody can do without any specific training, without any specific materials. Okay, because those, for my people, the people I work with, that's what's important. They're not going to all of a sudden carve an hour out of the day and learn how to play the piano. It's not going to do it. Why should they? They don't want to, they don't have time. Fine, they can do something else. They can still benefit from the way that music can help you to become mindful. And the benefits of being mindful are that if you are staying in the present moment, if you are not attaching emotional reaction to events that happen internally or externally, you have a lot less stress in your life. And a lot less stress in your life means you have a lot less inflammation in your body. So you can just keep going down the line. I mean, there's a lot of benefits. Improvisation, group music making, first of all, it's kind of like playing sports. Anybody play sports? You got a wakeful awareness, right? You got to know what's going on in the field. You also have to be patient. Somebody else has got the ball. Hey, you've got to plan. You got to go. You got to be flexible. Okay, improvisation. As Miles Davis famously said, there are no wrong notes. There's a framework. You got to trust yourself. You got to do it. If it comes out different from the way you expected, all right, makes sense. You can learn that. That's something that can be learned. Music-assisted relaxation. This is using music as a framework for exercises such as deep breathing, meditative exercises, and I'll get more into that later. And for me, the most important is the mindful listening, which trains attentional control, which is more than just objective awareness of the present moment. Attentional control is the ability to take your mind and bring it back. This is the root, for me, this is the root of many other interventions. I get many patients who come and say, well, my doctor tells me I shouldn't meditate, but I can't. Probably 90%. They tell me that would be good for me, but I can't. Oh, what they lack is attentional control. I can't do it. I keep thinking about that. You can train your mind to do that. I just can't do it. Wait, that's where music comes in. Okay, mechanisms of attention. Why does music work? Attention areas in the brain, you can see musicians, non-musicians. They both light up, musicians a little more. It's both top down and bottom up. The patterns of music, all music, even if you don't know it, is made up of patterns. John Cage's ghost is sitting right here going, not my music. So there were some composers in the middle of the 20th century who totally threw every single kind of pattern out the window, which is true, and I admit that. But most music is made up of patterns that keep repeating themselves. These create expectancies. The expectancies do several things. One, they engage your attention then. Follow something, it keeps doing the same thing you want to follow. It resolves itself, that makes you happy. You go to a movie, you don't know the plot, and it has a happy ending. Or what you expect to happen happens. Does it make you feel good? It's the same thing in your brain. When you're listening to music and you expect it resolved, and it does. You're like, oh, cool. So you already get this neurotransmitter shot that makes you want to keep following it. Also, the default mode network. This is your mind wandering network in your brain. And as you can see from both of these pictures, there's a bell curve. You want to find music that's familiar, that you like, because that also engages the reward pathways. It says, oh yeah, I'm listening. But if it's your favorite song, it might take you back to the first time you heard it. Oh, that was with my friends, it was really cool. And then all of a sudden you're somewhere else. And if you really don't like it, then it would just be like, not engaged. Let's start thinking about something else. Very interesting. So mindful listening, research on that, background music and attention, there's a lot of research on that. And the results are very mixed. It depends, it really depends on the type of music and the type of person. Generally, the music you like is the music that's going to help you concentrate, but not if you like it too much, right? It's got to be familiar, but not too familiar. Mindful listening has been proven to have a positive effect on attention. Now, the first three studies that you see cited there, Balin, Lesiak, and Wu, all use what's called deep listening, focused listening. It's like really listening to a song, thinking, what do I feel? Where does this take me? Why do I like it? The last one has a protocol which is very similar to the one that I'm actually developing with a colleague right now, which is exactly this. And this is specifically only to train attentional control. This is like you're going to the gym and you're training your abs or your biceps or whatever. You're training your attention muscle with this exercise. It's very simple. You select the music. You select the target instrument in the music, and you follow the target instrument. That's all it is. We're going to do it right now. This is a song that many of you might know. If you've ever been to a wedding, you know it. Pachelbel's Canon in D. In this particular version, the cello, the bass line is exactly the same all the way through. It's a repetitive pattern. You can hum along with it, it'll always be the same. Your job, your task, keep your mind focused on that no matter what else happens. When your mind strays, new instrument comes in, just bring it back. And if you really can't do it, raise your hand. Okay, you ready? You all ready on Zoom? And stop playing. Oh, it's funny, but I'm not hearing anything. Why not? Okay, little technical difficulties, no worries. Interesting thing is, it did work when I pressed it. Oh, somebody turned it down.
You're on the right way.
All the way up. Keep going. Keep going. Yeah, the guys on Zoom, you know, keep going. No. 50. Hey, that's good. Oh. Yeah, people on Zoom, we couldn't hear anything. We have to be able to do this stuff.
Okay, that says
No, I got the sound share.
air sound.
Stereo. The output. You guys can hear it. Under more. Right, hang on. Yeah, I know you hear it. I'm glad you hear it. Well, why don't we have
If you go back to more, the
Turn
stereo
down the
wasn't
volume.
selected, just in case we do it.
I don't think it has to be. Oh, we're so sad right now. This is really sad. Yeah. Well, those of of you who are on Zoom, how's it going?
Sorry, guys.
Are you able to follow? Master volume turn. Oh, wait, there you go, output. Oh, what, it's because after she connected the, microphone, that's when it stopped. Now we have.
Let's try it.
Now it's probably gonna be super loud. Okay, hold your ears. Right, how'd you do? What'd you do up there in Chatland? Lol. How was it, how easy or difficult was it to stay focused or return your focus to the target instrument?
I didn't find it difficult, but I wanted to be sort of seduced by all the other activity that's going on.
Violins are sexy.
Yeah.
I lost myself.
How about anybody else? Anybody else have a comment about that? How was it?
It was kind of soothing because of that expectation of like hearing, like almost like a lullaby in the back.
Yeah, it's also a nice calming piece of music. So that's if you all know Dr. Herbert Benson, the relaxation response. What you need for a relaxation response is two things: repetition and passive return. So repetition is that baseline, because it sure is repetitious. The rest of it changes. So yeah, so that's essentially it. That's kind of an easy piece because it's always the same. So once you know what it is and it comes in first, you're like, okay, I think I got it. I'm trying to lose it, but I know where it should be, so I can find it. You can do this with any type of music, though. You can use preferred music, which is great. It may increase motivation, may increase engagement. Also complexity, different people, this is the same something, so boring, yeah, exactly, boring or improved, well, it depends on the person. For me, I need something a little more complex, or else I'll zone out. You're like, okay, I've been there, done that, right? Other people, not so much. Other people, like the simplicity. There's actually a really neat study, I forgot who the name of the music therapist was, Stephanie, say it. but she did a study. She did a study back 30 years ago, so with children on the autism spectrum, and they realized that super complex music was helpful in the background for children who were high functioning on the autism spectrum to stay focused in their work, but children who were lower functioning had to have really simple music. If it was complex, they totally zoned out on it. So it really depends on the person. The more complex the music is, the more difficult it can be to follow. However, you can also use cues. You can use like a motor cue. You can move to it. You can breathe to it. Here's a piece that's a little more complex. It starts, there's a guitar, a bass, a drum. Pick one, and then stay with that regardless.
When I wake up in the morning, love, and the sunlight hurts my eyes, and something without warning, love, bears heavy on my mind. Then I look at you, and the world's alright with me. Just one look at you, and I know it's gonna be a lovely day.
Okay, how was that?
Excellent choice.
That's my go-to.
It's funny that you said the motor, or like having some other senses involved helps your focus, because I noticed that the last song and then also this one, I kind of nod my head to the beat, and that helps me focus in on the bass.
Yeah, absolutely. Yeah, that's a strong prompt, a strong cue. I love the song. Good question. Oh, we're gonna do that one later. Okay, the women's great choice. So, yeah. How about anybody else? What'd you pick? What'd y'all pick? How many picked the bass? Yeah, me too. How many picked the drums? How many picked the guitar? Okay, yeah, so that's just another example. And again, with the preferred music, use the preferred music that is not going to take you away someplace else. There we go. So what else can mindfulness do? Practicing the stop technique. This is from mindfulness-based stress reduction. Stop techniques. This is when you're in an acutely stressful situation. Practice stop. You stop. You notice where you're going. You notice what you're doing. You just stop. Take a breath. 2, 3. You notice that the breathing automatically starts to get a little more blood flow, get a little more oxygen going, starts to widen your horizon, you start to see a little bit better, see a little more clearly. Observe what's going on. What's going on? Okay, my heart is racing. Okay, what can I do about that? Proceed with awareness. Okay, so this is a piece of music that may or may not set your hair on edge in the beginning, anyway. And so obviously, if something like this is on, you can just turn it off, right? However, you can't always turn other things off. You can't turn situations off. So this is a training. Say, okay, I don't like this. Okay, what am I hearing? What's happening? Can I breathe through it? Can I breathe deep through it? Can I find something in it I like? And focus on that. Okay, ready? Go. How was that for you?
Yeah.
So it'd be interesting to study the minds of the people that created that. Like, what was so much discordant activity, what's going on?
Okay, this is from Yes, best art rock group of the 70s. And this is a 7-minute song. It gets super calm after that. That's just the intro.
Wow, it's interesting.
It's called Part of the Sunrise. Check it out. So, but how was that for you? What did you notice as soon as it started? Did you like it? Was it like, oh my God, what's going on? Was it about? How was it?
I was predisposed, but I actually liked it. I liked it.
Okay, so you didn't notice any unpleasant. I wasn't sure you breathed too much. Ouch.
I think it's the level of stress.
Oh, it was loud.
Yeah, it's a lot louder, right?
It was kind of like syncopated, like the instruments would come in and out, so if you were following one,
Yeah.
and it went out, you were like, what do I do now? And then wait.
So how about observing, stopping, and then just taking a breath anywhere. And proceeding. Anybody try that? Yeah? Is that useful? Is it not useful? What's useful?
I followed the drum, so I could anticipate like when it was gonna come back in. So,
Okay.
like in the breaks, I would stop and.
Okay, so it's kind of loud in the beginning, and then you were like, okay, let me find something that makes some sense at all. So, and you were like, okay, the drums make sense.
Yeah.
Let me stick with that. Let me breathe through that. So,
Yeah, and I could anticipate when the breaks would be for the drums.
okay, cool.
See, I found myself having to pay more attention to this. I don't know. I was also thinking the difference between musician, non-musician, familiar versus non.
Yeah.
Because like Pachelbel's canon done a bajillion and a half times. So it's really hard for me to focus because it's so automatic.
Oh, got it. Okay.
Whereas this, I was focusing much more because I was trying to figure out the meter, the syncopation. Okay, when's the time signature change? Like, so I was focusing much more on this.
Cool. The drummer is Bill Bruford. If any of you know anything about 80s fusion, you can look him up. All right, so just go on to the, I think I'm probably at probably have 5 minutes before 12:45. Do we have 10? Or 7?
2 before 45.
Oh, 2. Okay. So music-assisted relaxation. As I mentioned before, this is, so first of all of that with the music, with the listening, this is training. It's an exercise. You do this to train your ability to control your mind. All right. Somebody calling saying, I want to do more. Music-assisted relaxation. Why do we put music with a meditative exercise? To make it easier for a patient we're working on to stay with the exercise, to engage attention, to promote patience, to facilitate staying in the present moment. Okay? So what I would play, and I'm going to need somebody to help me here. I'm not going to take the music therapist in the room, I'll just take somebody else. So sorry, those of you on Zoom, you have to do this. Oh, actually, it's not your turn. Sorry. So I'm going to play, but you'll get to play in a second. So if I play a repetitive pattern like this, and I encourage the person to breathe through it, so it gives them a kind of a framework. That's repetitive. So even if I'm doing something like a body scan to this, some other sort of meditation, subconsciously follow this pattern. useful in training. So what do you do if you don't have your friendly music therapist to come by and do that for you? Hey, YouTube is full of this stuff. Just use it. Put something on YouTube. Feel like they, oh gosh, my mind is running, it's running. It's okay. Find something calming. I mean, they designed the music for that. A lot of people are doing this nowadays. It's repetitive. It's not so repetitive that you're going to zone out. Put something on while you're trying to do a meditation. This helps you to focus, like training wheels. Improvisation. So we talked about it before. It's like playing sports. Very much like playing sports. You're aware, you're alert, and you can't think ahead. Well, you have to think ahead a little bit, but you can't think ahead so much into tomorrow. Improvisation by yourself. There's a lot of research on that, actually. Charles Lim, I don't know if you ever looked at Charles Lim's research, very interesting about the neuroscience, what goes on in the brain of people who improvise. And there's also tons of music therapy research on the use of music improvisation for facilitating communication, for social skills, for all sorts of things in children and with adults, both, in a number of different populations. However, how to use improvisation to practice mindfulness. Not any research on that. You can all be the first. But all of these things are important in improvisation. Any type of improvisation, by the way, not just music. So music is kind of fun. You have a pleasurable music stimulus. Plus, like Miles Davis said, there are no wrong notes. There's a framework, but no wrong notes. Non-judgment. Anything you do is fine. Beginner's mind. You don't know what you're going to do. It's kind of fun, right? I think it's fun. I have no idea what's going on. It's great. Trust. You have to trust yourself. And also non-striving. This is a big one. I love this. So you have to be invested in the process, not the goal. In improvisation, there is no goal. There's absolutely no goal. You play the head once, then there's like 15 minutes worth of improvisation. If you've ever been to a jazz club, you know this is how it goes. And then at one point it said it had enough, so they go back and they do the head again. That's all there is to it. And it's never going to be the same. There's no goal. It's very liberating. So we're going to do two things right now. Which one of you wants to do? Both of you? We're going to improvise. Sorry, I have my back to me. So we're going to improvise in two ways here. You can just play. Nice. The rest of us are going to breathe. And we're going to vocalize. Yes, I saw that book. I didn't say sing, I said vocalize. I always say singing is the ultimate leap of faith. It's like standing up on a stage without your clothes on. And like hear my innermost thoughts. I hope you like it. We're not going to do any of that now. We're just going to breathe in. Like a sigh. At your own pace, breathing in, vocalizing. Move it around if you want to. Do something like. Or you can just hum. Great job. You did great. How'd you feel?
You're indecisive, I guess.
I felt like towards the end we started getting into a groove, we started experimenting a little bit more.
Yeah, that's what I usually do. I usually just stand sit here and play. And I let people like kind of bash around on it. They find, no need to micromanage them. They usually find out to do something. Did anybody trust themselves to do a little humming, a little singing, a little oozing? Some of you did, some of you didn't. How did it feel? Those of you who did, feel good? Feel weird?
I hummed and could feel what they were doing more. The vibration of what they were creating. I could feel it more deeply.
Oh, nice. That's cool. That's interesting. So when you hummed, you kind of felt the vibration of the sound more. Oh, that's very interesting.
Does it matter if you have your eyes open or closed with like results?
No, but I find that when people have their, well, first of all, if your eyes are open, if your eyes are closed, you're eliminating the visual stimuli, so your mind's quiet. Usually, for like a normal person in this setting. Now, on the other hand, if it's somebody who is clinically depressed, or has clinical general anxiety disorder, it's possible they could close their eyes and start ruminating. So the answer again, as usual, as always is, it depends. But for this exercise right here, I think it might have, I invite you to close your eyes, because when our eyes are closed, we're kind of shutting out the others, and sometimes we have a little more confidence to do things that we might not otherwise do. Anybody else trying using? Great. Conclusions. There it is. So I hope you learned something new, something you can try, something you can take home with you this month.
What are your thoughts of trying this while studying?
So again, trying what while studying? Listening or playing an instrument while studying?
Listening to music.
It really depends. So sorry, but that's the absolute truth.
Okay.
I used to always say I can't have music on when I'm studying because, I've played so many different types of music and I know so much repertoire that immediately I'd be like, oh yeah, I know that piece. Well, why are they doing this? I would have done it that way, I'm supposed to be studying, it just doesn't work. Then I caught on to the idea of playing something, a genre I enjoy, that I've never played. I discovered John Dowland lute suites. And I'm like, yeah, because I don't play lute, right? So I don't know anything about this repertoire. So I would put that on, and that actually was helpful for me. Because it was it was pleasant, it's a pleasant sound, it's repetitive, in a way, but not, it was really nice and helped to quiet any background noise I might have had in my head. And because I didn't know that piece and I have absolutely no desire to play the lute, at this point, it was great. That really works for me.
Do you know if there's any data looking at music improving test scores?
Yes, there's a ton of data on it. I didn't write it all down because there's so many studies on that. And inconclusive. And sometimes yes, sometimes no. It depends on the population, it depends on how the study was constructed, it depends on the type of music I use. I was doing some research for a presentation actually about food and music. And marketing, by the way, if you want to know, that's a good place to look for research about background music. And two studies I looked at, one in Denmark and the other was in the States somewhere, I don't remember exactly, so a while ago. Both said that the background music actually, ambient music, it masked the noise of the restaurant and calmed people down so that they made healthier choices when selecting from the menu. Yeah, I thought it was pretty cool. But yes.
Does it help with like ADHD and like with attention?
Yes, and it depends. No, it's very individual. It's so individual, and with ADHD, I mean, it depends on exactly the level, again, the complexity of the music. Sometimes I've had patients who have ADHD, and super complex music is what helps them. but other patients maybe not. So it's trial and error, and it's definitely worth trying.
The other music therapist that I used to work with, we share an office, that her, like when she needed to like, her like focus music, like what she would do to studying, but when we needed to like get like reports done or whatever, her focus music was like very complex, orchestral, dissonant, which like set my hair on fire. And for me, like my focus music is like solo piano. That's all I can do. I have a very specific playlist that I use. But even though we're both musicians, we're both music therapists, very similar, our focus music and what works for us are completely different.
Yeah.
And we couldn't do work at the same time.
I know you mentioned research on mindfulness in cancer patients. Is there anything specifically on music therapy in cancer patients?
Yes, there's a lot. And because music therapy, so again, music therapy is really kind of a broad field, right? So there's music therapy for anxiety, there's music therapy for pain, there's music therapy for attention, there's music therapy for this, for that. So there's a lot of studies, and depending on what exactly you want to research, you'll definitely find something. There's also pediatrics versus adults. I only work with adults, for example. I don't work in pediatrics at all. I think there's a Kauffman systematic reviews from 2018 or 20, did they do a new one in 2020?
I think there's an updated one.
Yeah, there's an updated one. Kauffman review on music therapy interventions for cancer patients. So you can, and that'll list a lot of stuff.
Thank you.
Oh, I'm sorry, yes.
So you said that like a lot of these, like it depends, right? Is there any controls for like maybe genre or like personal preference? Because you know, you have that one slide where it shows like a dislike, like versus favorite.
Yeah.
Maybe is there any common patterns on like typically these genres kind of are conducive to these behaviors, or is it more like very individualized, like each individual responds to different genres differently, and that's how they'll get the benefits or drawbacks from this?
Absolutely. I mean, this article I was talking about that talked about background music in restaurants, they had heavy metal on. And I was like, really? It's about the sound level. At a low enough level, it just masks the ambient noise. People got more relaxed to it. It's not my choice. But the thing is, you know how they say the exercise plan that works is the one you're going to stick to, or the diet that works is the one you're going to stick to? Same thing with, say, music listening. The music listening plan that you're going to engage in is the one that's going to work. If you like heavy metal music, if that's what relaxes you, then yeah, that's good for you for studying. If you don't, it's not going to work. Actually, you have.
Yeah, I did. So let's say I had a patient that I thought could benefit from this. How would I get them in music therapy? Is it like something that insurance covers, or?
Yes, and is it a cancer patient?
Just any patient. Yeah.
So because cancer support services is free for the patients at Sylvester. So if it's a Sylvester patient, they just get a referral for one of us, and then that's free. Otherwise, yeah, there's insurance. I don't actually don't know because I don't have to do it. But it is covered by insurance. So,
so they can write an order. They can put in an order for
Yeah.
therapy at any of the institutions.
Yeah, exactly.
So while you're on that, can you all, for those of you who are going into the hospital, anybody going into the hospital yet? No, you're going in a month. How could you see using this for the hospitalized patients? Which is an extremely anxiety-producing entire moment.
Maybe perhaps like if there's a patient just waiting for results or waiting for the doctor to come back and like, hey, your earplugs, you have your earbuds. We learned that listening to some music can help some stress calm down, just an idea. Because there is a lot of waiting involved in like medical care. I feel like a lot of them like watch TV or like home, but encouraging them to mindfulness.
It seems like a tangible way too, because I feel like a lot of doctors will just say, "Oh, practice mindfulness," but not have like a follow-up or really know how to pursue it. But saying, "Okay, like music therapy is something that's tangible." I also had a follow-up question to this, but would patients be able to seek out therapy themselves? Like, let's say, because as medical students, we might not be able to order it, but if we encourage them to seek out musical therapy, are they able to go like around a doctor, or is it usually through a doctor?
Depends on how they want to pay for it.
Okay.
Yeah, they want to, like, again, at Sylvester, if it's a Sylvester cancer patient, they can just call the cancer support services and make their own appointment for that, because we don't bill. For anything that's billing, they will need a referral from somebody. But they can tell the doctor. But I overheard, you're absolutely right, that's what happens a lot. That's why a lot of the psychologists are now referring their patients to they'll be like, try this breathing exercise, try this, and they're like, I can't do it. They're like, oh, but I know she has ways. So they just send them to me. Yes, you had a question.
And in response to you, and then also my own question. So I was at UMH the past month, and you have like physical therapists, occupational therapists coming every day for a little short amount of time for all patients, but I never saw like any music therapists or anything. And I feel like that would be helpful to have music therapists come see the cancer patients for like.
Please tell all of your administrators.
There's no try.
Because there's no one over at UMH.
What, you mean Utah? Sure.
I mean, like full time.
Oh, okay, so cancer patients. Only the cancer patients.
But the entire tower, there's no one.
No. Yeah, you have, well, it's that's it's a very complicated scenario here, but we do go see the patients who are on the cancer floors, the oncology floors, and the rest of them. Yeah, like Stephanie said, talk to administrators. They, you know.
Oh, I can't get it.
It's like, well, like I'm at Holtz, which is within Jackson, but we only go to pediatrics. Like, we don't cover the adult side because there's not enough of us. But yes, every time someone says like, oh my God, why don't we have this on the adult side? That's a great question. You should tell your administrators.
And you're covered by Holtz.
Yes.
Or insurance will reimburse.
So we don't, so same with cancer support services, we don't bill. It has to do with, we've looked into it, I talked with our CFO, it has to go, it goes into like the DRG, outpatient, they can bill.
Outpatient, they can bill. Interesting.
It's a whole thing. Well, we don't talk about it.
Yeah.
But yeah, they don't get billed for services.
Right.
I was looking at the chat, see if there's anything or anything else.
I mean, something I find interesting as well is maybe not even formal like music therapies, but like she said with the whole restaurant phenomenon, you know, you go to an emergency room or any of the floors, like either it's incredibly quiet, which is super isolating for the patient, right? Unless they have a TV going on, which also can be very nauseating in that environment. If you don't have that, it's either that or like alarm bells and you know, lights and bing bings and that. So, you know, even something general that's just kind of masking that kind of chaos and can help alleviate that. Isolation.
We try. And the issue is that you would have to, at least in Sylvester and also Utah, you have to rewire the building. The way the intercom system is wired right now with the speakers, it's throughout the whole thing, like operating rooms and everything, and not everybody wants some ambient music. So obviously in the waiting areas and even in the hallways, it would be great. But they have to update the way everything is wired first. So they have to run two separate systems. So that they have one with the background music and one without. That's find a donor.
I worked for the Indian Health Service, and every Sunday, the entire hospital would play sort of traditional music. And it really changed the feeling of the day.
Yeah.
It was there wasn't a lot going on Sundays typically, but it created like a more spiritual sense to the whole building.
Well, we put music in the jungle. We said that, got that set up, I don't know, maybe 6 months ago.
Where? rooms and the little jungle area.
Like outside, there's like a little area with like picnic tables. And
Yeah,
And that totally changed that vibe. People used to just kind of walk through and now they're like, no, they take these long lunch breaks. Yeah, so we're working on that. You're absolutely right. That's something we need to do, and it's really just a physical matter of getting, seeing what we can do about it, seeing how to do it. It's logistics. Any other questions? I don't think anybody in chat land is still there.
Great, thank you very much.